HIV training package. The purpose of today's call is to provide you with a little bit of background on the training package, how we conceived of it, what's in it, how you can use it, putting it to work for your clinical learning team, and what your next steps are in terms of using the training package. One of the outcomes of the AATC NCHCMC is to improve access to HIV care and treatment by increasing the size and capacity of the HIV provider workforce. There are two ways that we can do this. One is to provide learning resources and methods for health centers to begin to use in delivering or improving HIV care and treatment on site. The second way is to develop and test effective, efficient, realistic, and replicable distance learning models to increase access to HIV care and treatment. A little bit of background on the HIV training package. One of the things that we really used as a priority was to standardize this process, the package, based on in-service learning. We know that you're all busy primary care providers, and we want to make sure that we meet your needs. Secondly, it's based on the stages that we presented at the launch meeting. And third, we have two core pieces, two core texts that are the basis for this. One is the HIV/AIDS Bureau's manual called Guide to Clinical HIV/AIDS Care, and the second is the Department of Health and Human Services Guidelines for HIV Care and Treatment. A couple of other foundation pieces. The HIV training package is self-directed and self-paced, meaning it fits into your schedule. It's flexible and user-friendly and is designed with you in mind. We also intend to update the training package every 6 months using evidence-based resources and tools. Additionally, it's supported by clinical consultation from the regional AETCs, those folks that you've identified to be your clinical mentors. Currently, Stage 1 resources are available. The objective of the training package is to help move your care team up one level from Stage 1 to Stage 2. All of the health centers participating in this call are designated as Stage 1. And what you'll see later in the presentation is that the Clinical Learning Action Plan provides you an opportunity to agree or disagree with your stage. So we ask you to please take a moment to do that, as the instructions will say later in the webinar, and return that to us. The purpose of the training package ultimately is to solidify your knowledge in your current stage and prepare you to move ahead. There are two key components of the training package. One is learning resources, the other is tools. The learning resources are proficiency-based and divided into curriculum menus so that you can choose and select which pieces are right for you. Also, currently we have the Stage 1, Part 1 for providers and RNs. Coming soon are other resources to support your other members of your team. So the tools in the training package are the Clinical Learning Action Plan, which we'll cover later in the webinar, the User's Guide, which is a comprehensive list of instructions and suggestions for you, a monitoring framework, and a tool to help you introduce the package to your care team members. The HIV training package is holistic in nature. It takes into account the needs of all of your care team members, not just the prescribing clinicians. The result, we hope, is more effective, efficient HIV care and treatment delivery. With that, I'll hand it over to my colleague, Christine Stewart.
Thank you, Brad. And so one of the first things that we want you to look at is the Clinical Learning Action Plan. As you can see right here on your screen, it's one of the first things, again, that we want you to review before any of the other resources. It's the only document that we've posted that requires a response from you and your team right now. So the Clinical Learning Action Plan asks you to update the role and the names of the care team members. We know many of you have added more people since we've last discussed care team members. We also ask you to appropriately stage your health team, make sure that what we've identified for your care team is appropriate. We also want to know whether or not the training completion date is realistic. So when we ask that you access the action plan in the private forum that's been created for your health center on the virtual learning lab, and when complete, please submit it by email or on your health center's private forum. The next item that we want to bring to your attention is the user's guide. Now, this is also I just want to briefly explain what's in the user's guide, and then we'll review each part in more detail later in the presentation. The user's guide provides detail on the content and the format of the training package. It explains steps to develop a tailored training plan, and it discusses several options to help you monitor the progress of your care team members in the training package. Next, we have the curriculum menus. Now, this is really the meat of the training package. It's the foundation of the training package, and it has proficiencies required to provide HIV care and treatment, recommended core learning resources for each proficiency, as well as supplemental resources, and we've identified the specific page from each resource material that are applicable to each proficiency, so you don't have to search around. The next several slides provide more detail on the curriculum menus. So I just want to identify some key elements of the curriculum menu design, and those are that the curriculum is a one-stop shop to accessing online resources for each proficiency, provides direct links to multiple sources and types of resources, and is an emphasis on learning resources that offer Category 1, CME, and CE credits. We'll also be regularly updating to maintain the most up-to-date resources. The menus are divided into core resources and supplemental resources. And the core resources, depending on whether the learning resources are directed towards prescribing clinicians, RNs, or other members of the health team, are primarily the HIV/AIDS Bureau's Guide for HIV/AIDS Clinical Care, the Department of Health and Human Services Guidelines for the Use of Antiretroviral Agents in HIV-infected adults and adolescents, as well as our ATC and CHCMC webinar series, which can be accessed live, or you can also access the archived versions on the Virtual Learning Lab. We also will be using the Association of Nurses in AIDS Care, ANAC, for curriculum for HIV/AIDS Nursing 3rd edition for the nursing curriculum. All members of the care team who are eligible for that level of curriculum should review and complete the core resources. I just want to make an important note. The HAP manual is not currently available to order in hard copy. Each of your health centers received one copy during the launch meeting, and we've also included an option to download the full manual in the Virtual Learning Lab. The RN curriculum menu is based on the ANAC book, which you see on the slide, and we will be sending each of you a copy soon. I believe they're available for order in December, but we will first need to get your clinical learning action plans back from you. And this book is also not available online. Next, I just want to discuss the supplemental resources. We've included these for care team members who wish to review additional materials to complement the core resources that I mentioned previously. We have them in a variety of formats to reflect the preferred learning methods. We have several resources from our sister AATCs, online and print materials like textbooks, journal articles, case studies, HIV databases, job aids, PowerPoints, mobile applications. We've tried to identify materials that were free so that you don't have to pay for them, so that anybody should be able to access these materials. Next, I just want to talk about the format of the HIV curriculum menus. We have two versions. One is the Microsoft Word version. It contains the recommended learning resources and associated links in list form, as you see, using Proficiency 1 as an example. And again, this is proficient. So then, again, there are two ways to access the menu, as you see on this slide. The second way is the Microsoft Excel version, which is on this slide right here. And we've provided two different ways just because people learn in different ways and can visualize material differently. It also contains the same recommended learning resources and associated links that we have in the Word version, but this is just in table format. This slide illustrates the layout of the curriculum menus in Excel. Now I just want to discuss some examples of how you and your team can decide to use learning resources in the curriculum menus. You can review them individually and then decide to discuss them in pairs. You can get together in a group to review the materials. You might want to divide up your teams and to make sure that everybody in the same discipline reviews those materials, or you can do review the materials in multidisciplinary teams. Or alternatively, you might decide to do this in consultation with your mentor. The next item I want to discuss is now that you're more familiar with the curriculum menus and how to use them, let's talk about developing a training plan. The user's guide discusses this in depth and lists the following steps: accessing the virtual learning lab, then reviewing the proficiencies and the curriculum menus, asking care team members to review the proficiencies, compare with a topic they selected on the self-assessment form, also define teams and individual HIV training goals and objectives, and then lastly, develop a training plan. Once you've downloaded the curriculum menus, lead your team through steps 3 and 4, review the proficiencies and menus, recall their answers on self-assessment forms they completed, and decide which proficiencies they would like to work on as part of the training. If no assessment forms are completed, just review the proficiencies as they are currently stated in the menus. We will talk more in detail about step 5 after reviewing all 10 steps. Next step, 6 through 10, ask the team to estimate how long it will take to complete the learning resources, establish a need for additional support, supplement their learning resources, develop a method and time frame to monitor and evaluate, set an established benchmark, milestone, or outcome, and begin to identify and address potential system barriers. Now, please work with your team on steps 6 through 9 to add information to this draft training plan. Step 10 is very, very important. It's anticipating possible system barriers. This is because no matter how good your training plan is, if there are system barriers that prevent you from actually implementing the plans, your desired training outcomes may be compromised. And next, we will have our newest clinical team member, Stefan Perez, discuss the training plan with you.
Thank you, Christine. So now that we briefly covered the steps in how to develop a training plan, let's talk more about the components of what a training plan are. A training plan includes schedule or training calendar, specific dates, times, frequency of care team training activities, proficiencies, topics selected included in group and individual training plans, anticipated date of completion of each proficiency for each team member, roles and responsibilities of each care team member to accomplish team training goals, and method and frequency of assessment of care team training activities. Ask a care team to review with you the curriculum menus for each type of team member. Select priority proficiencies, realistic individual and group timeframes, and delineate clear roles and responsibilities for each care team member. For example, can some members mentor others with less developed HIV skill sets? Discuss the method and timeframe to assess and monitor training activities. Establish goals and objectives, benchmarks, and milestones. Decide how the team prefers to demonstrate evidence of learning progress towards training goals. And please let us know if you think you will need assistance in developing your training plan. This is an example of the monitoring framework that could be used for monitoring the HIV training progress. We've included a simple monitoring framework that contains 5 basic process indicators to provide information to you and AETC and HCMC on your team's use of package and resources. They're not outcome indicators to measure effect on care outcomes. We would appreciate if you and the team use some form of this type of process indicator progression, as it helps us to know which parts of the curriculum menus and training package you used and to what extent. If you develop other monitoring methodologies, including a framework based on outcome indicators, please share it with us, or again, we can assist you to develop these further. The training package and curriculum menus are dynamic. Additional curriculum menus will be available by early 2012. This should allow your care team adequate time for the team to complete the currently available curriculum menus, Stage 1, Part 1. approximately 3 months. Learning resources that meet the criteria for inclusion in the curriculum will be updated into the curriculum menus every 6 months. New tools to help you with training will be posted as they are developed. The Virtual Learning Lab is your portal to access the HIV training package. Also, you have individual forums where you and the team can share experiences, questions, and plans as you roll out the materials. The forums can also be used to ask questions of the AETC, NCH, CMC staff, as you know. In addition to regular updates of the HIV training package, learning resources and tools on the VLL, we will soon launch an interactive forum for clinical discussions of topics and training methodology questions as well. Also, care team members are welcome to suggest learning resources they think could be included based on the criteria for inclusion into the curriculum. Team members are also welcome to suggest articles or resources that may not be appropriate for the curriculum, may not be evidence-based or still preliminary findings. These will be posted elsewhere on the VLL for care team members and others to review and share. Some implementation issues to consider. As we said earlier, environmental factors in your practice setting can influence the ability to carry through on even the best training plans. Let's talk a bit first about how you can explain to your organizational leaders and to your care teams why it is important to participate in the clinical part of the program. Individual and team professional development in HIV care equals improved service delivery. Contribution to the development, testing, and standardized national HIV distance learning model are also important. If interest wanes, let's talk about some ways to re-energize the team and strengthen HIV training activities. These could be getting staff buy-in, identifying learning incentives, developing internal care team learning partnerships, integration of regular care team learning events into schedules, managing competing priorities, and linking with external learning partners. So, we understand that we provided a lot of information to you just now. We want to highlight the key things that you need to do next. If you haven't already done so, please download the HIV training package from the Virtual Learning Lab. If you're having trouble logging on or don't have a login, please contact Jarrett Casanidi. His contact information is on the next slide. Second, we are requesting that the clinical learning leaders access your health center's clinical learning action plan and return it to us electronically. This is a priority, so please do this week. Third, work with your team to develop a training plan using the resources in the training package. If you need help, as always, please feel free to contact us. In the meantime, we will be reaching out to you to see how you're doing. We're now going to open it up for discussion and questions.
Thank you very much, Stephan. And I am unmuting all your lines so you may ask a question verbally. Alternatively, if you would like to, you can use the chat function and we'll read your question and read it to the group aloud and answer it for everyone to hear. Your phone lines are now unmuted. And I know we've thrown a lot of information at you, so I would like to encourage you all to ask any questions you have while the presenters are here.
And again, if you have not already done so, as Stephan pointed out, please do access the training package from the Virtual Learning Lab. If you're having trouble accessing it, Jarrett Casanidi is available to help you locate it and navigate through the Virtual Learning Lab, as well as give you your login information if you've misplaced it. Jarrett has just switched the slides, so here we've listed all of our contact information. Jarrett, again, is the person that you would contact if you're interested in, if you need help with your login to the Virtual Learning Lab, but the rest of us are available for questions, and feel free to contact us by phone or by email.
Thanks, Christine. and thanks everyone for joining us on today's webinar. As usual, the webinar recording will be posted in the Virtual Learning Lab, and while you're there, you can post your questions and comments in the forum. And as Christine mentioned, you can reach Brad, Christine, Stefan, or any other member of the AETC NCHCMC clinical team by emailing us at clinical@nchcmc.org. Thank you very much, and enjoy the rest of your day.